Now, let's focus on the use of an AED. You'll need to familiarize yourself with the AED device that you'll be using today for your training class. There are some differences for the use of an AED for infants and children under 8 years of age. Some AEDs can deliver either an adult or child shock dose. The child dose is used for children under 8. If you are using a pediatric-capable AED, it will have features allowing a child-appropriate shock. But the type of feature available depends on the type of AED you're using. Your AED may include smaller size pads designed for children under 8 years of age. If it does, use them. If not, use the adult pads, making sure they don't touch or overlap. However, you should never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult, and it will likely not be successful. It's better to provide high-quality CPR than to attempt to shock an adult victim with child pads. Some AED pads recommend a different pad placement for infants and children, placing one pad on the chest and one on the back. Follow the pictures on the pad packages for proper pad placement. Although AEDs may differ slightly, there are 4 universal steps for operation: turning on the AED, attaching the pads to the patient, analyzing the heart rhythm, and delivering a shock, if indicated. To begin, turn on the AED. Simply open the carrying case or the top of the unit and power on the AED. Some devices will power on automatically when you open the lid. Either way, after the AED is on, attach the pads to the child's chest by using the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the child's age, use the adult pads. You may also need to plug in the pads for certain models. Following the pictures found on the pads, attach the adhesive pads to the child's bare chest. Place one pad on the child's upper right chest, directly below the collarbone, and the other to the left side of the left nipple. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED will deliver an audible prompt when it's ready to analyze the rhythm, followed by a prompt to clear the child or infant. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command. Once the AED completes its analysis, if a shock is advised, it will charge.
Shock advised. Charging. Do not touch victim.
Clear.
Most devices will prompt again to clear the child or infant. Some devices, however, will allow chest compressions to be performed during the charge phase. Providing compressions during the charge phase is optimal, but be familiar with the devices you have access to so that you'll know whether to provide compressions during this phase. The rescuer should again repeat the clear command to those nearby and visually confirm that no one is touching the child, not even the person in charge of giving breaths. Press the shock button. The shock may produce a sudden contraction in the child or infant's muscles.
Push the shock button now. Shock delivered. Resume chest compression.
1, 2, 3, 4, 5.
After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates that no shock is advised, immediately start chest compressions. If the child has water on the chest, this can be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the child's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the child is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the child.